Welcome to another episode of Recovery Dialogues and Sober Stories. We aim to facilitate meaningful conversations about substance misuse and dual diagnosis. Today's episode is sponsored by Wish Recovery, a top-notch rehab facility that provides comprehensive and compassionate care to help individuals recover successfully. In today's discussion, we will be focusing on the impact of addiction on the LGBTQIA+ community. Substance misuse and addiction, a societal plague that indiscriminately gnaws at the fabric of humanity, have been a significant concern across the globe. When peeled back to reveal its impact on various communities, it becomes evident that some are disproportionately affected more than others. Among these is the LGBTQIA+ community, a vibrant mosaic of individuals who, despite their resilience and diversity, bear a heavier burden of substance misuse and addiction. Substance and alcohol use disorders pose a distinct challenge within the LGBTQIA+ community, underscored by higher rates of substance misuse compared to heterosexual individuals. This disparity is not incidental, but a byproduct of persistent stigma, discrimination, and the chronic stress of existing within a predominantly heteronormative society. The struggles of this community often remain invisible, exacerbating the problem and birthing a cycle of emotional distress and isolation that can fuel addiction. The intersectionality of sexual orientation, gender identity, and substance misuse further amplifies these challenges. Traditional recovery approaches, largely heteronormative in design, fail to address the unique needs and experiences of the LGBTQIA+ community. This oversight can lead to insufficient support, lower success rates in overcoming addiction, and deter individuals from seeking help due to fear of discrimination and misunderstanding. Compounding these issues are harmful practices such as sexual orientation and gender identity and expression change efforts, which not only lack scientific grounding, but also inflict severe harm on the LGBTQIA+ community. Furthermore, underrepresentation in STEM fields can engender feelings of exclusion within LGBTQIA+ individuals, potentially impacting their mental health and catalyzing substance misuse as a coping mechanism. The convergence of these factors creates a silent epidemic of substance misuse within the LGBTQIA+ community. To address this, we must foster understanding, promote inclusivity, and tailor recovery programs to meet the unique needs of these individuals. Only then can we begin to bridge the gap between the LGBTQIA+ community and the resources they need to combat addiction effectively. Our featured guest today is Daniel Ingersoll, a certified substance use disorder counselor who has a background in addiction recovery and mental health. He has diverse experiences such as managing a sober living home, recovery coaching, and working in treatment centers in Los Angeles. With his profound insights into addiction recovery, Daniel is particularly passionate about helping the LGBTQIA+ community overcome the unique challenges they face in substance recovery. He believes in evidence-based practices tailored to support the specific needs of this community. Daniel also strongly believes in the power of shared knowledge and resources to foster genuine recovery and resilience. I'm grateful to have him on the show, so let's dive in. Daniel, what challenges does the LGBTQIA plus community face with substance use disorders? How do societal pressures, discrimination, and internalized stigma contribute to higher addiction rates?
In the LGBTQIA plus community, there's a unique and complex set of challenges that are tied to substance use disorders. It's a mix of all of these. Let's start with societal pressures. We're talking about the stress of trying to fit into traditional gender and sexual norms. This kind of pressure really weighs on somebody. When you're constantly bombarded with messages that your identity is different or not the norm, it leads to a profound sense of isolation and also a relentless pursuit to conform. These pressures are exhausting, and they often lead to higher stress levels, which, in turn, leads more people in this community to use substances as a way to cope. It's not just about dealing with day-to-day discrimination, it's about grappling with a society that often doesn't reflect or accept your identity. And when societal acceptance feels out of reach, substances can become a refuge, albeit a harmful one. Then there's discrimination. Facing daily discrimination, or what's known as minority stress, is tough. It's something that a lot of LGBTQIA plus people deal with, and sadly, it's linked to higher rates of substance use. Meyer's research in the Psychological Bulletin really hones in on this, showing how these stressors contribute to health issues, including substance use. The relentless nature of this discrimination, whether outright hostility or the more insidious forms like microaggressions, can take a significant toll on mental health. This ongoing battle against prejudice and exclusion can lead to heightened levels of anxiety and depression, making substances an appealing escape for some. It's not just about facing negative attitudes, it's about constantly having to prove and defend your worth in a society that often questions or devalues your identity. Internalized stigma is another big one. Many in this community internalize negative messages about their identities, leading to a lot of internal conflict. This kind of self-stigma is tied to increased substance use. It's like, if you're struggling with accepting yourself, sometimes substances just become a way to escape those feelings. And we can't forget about intersectionality. For LGBTQIA plus folks who are also part of other marginalized groups, these challenges are even greater. There was research in drug and alcohol dependence from 2015 that shows that dealing with multiple stigmas can lead to even higher risks of substance use disorders. This research underscores the compounded difficulties faced by individuals who navigate not just one, but multiple marginalized identities. For example, a queer person of color might face racism in both the general and LGBTQIA plus communities, which heightens their experiences of discrimination and exacerbates feelings of alienation. These overlapping stigmas can create an even more profound sense of isolation and misunderstanding, making the turn to substances a more likely scenario as a form of coping or temporary relief from the societal pressures they face. So, when you put all these pieces together, societal pressures, discrimination, internalized stigma, and intersectional challenges, you get a really complex picture of why addiction rates are higher in the LGBTQIA plus community. It's a reminder of how important it is to approach substance use disorder treatment and prevention with a deep understanding and empathy for these unique experiences.
How do minority stress and the search for identity play a role in the vulnerability of the LGBTQIA plus community to substance misuse?
So, when we're diving into why the LGBTQIA plus community might be more vulnerable to substance misuse, there's a couple huge pieces to unpack. Minority stress and the search for identity are really at the heart of this. First up, let's talk about minority stress. Imagine this extra layer of stress, kind of like a heavy backpack that you're carrying around just because you're part of a stigmatized group. For people in this community, this means facing daily discrimination or sometimes just the constant worry of it. It's those small cutting remarks, the sideways glances, or the outright cold shoulders that can just chip away at you. It's not your run-of-the-mill stress. It's relentless, and it really digs deep, which makes the idea of turning to drugs or alcohol just for a bit of relief seems really appealing. Then you've got the whole journey of figuring out who you are. This can be a massive adventure for many. It's also way more than just coming out to the world. It's about coming to terms with yourself in a society that really is not always accepting or understanding. This path can be super isolating, especially if you're feeling like you're the only one walking it. That kind of solitude, or just the struggle to find your place, can lead to some people to lean on substances. It's like they're seeking a bit of comfort, or maybe a way to feel connected. And here's another thing. Often this community's safe havens and social circles are in spots where substance use is more visible. These places, while they offer a sense of belonging and understanding can also unintentionally make using substances seem like just another part of hanging out or fitting in. So, when you piece all of this together, the relentless nature of minority stress, the emotional roller coaster of self-discovery, and the social dynamics where substances might be more common, it really begins to paint a clearer picture of why there's a heightened risk of substance misuse and abuse.
Are evidence-based strategies or interventions effective in addressing addiction among the LGBTQIA plus population? How can treatment and support be tailored to meet their unique needs?
Evidence-based strategies and interventions can be effective in treating this population, although there's certainly ways that we can make them more so. When we talk about tailoring evidence-based treatments for addiction specifically for the LGBTQIA+ community, we're looking at a few key adaptations that can make a world of difference. First, a lot of treatment programs focus on touting their inclusivity, but I really don't think that's enough. It's about creating a treatment environment that's more than just inclusive. It's about having therapists and counselors who are not just culturally competent, but also have a deep understanding of the unique struggles that are faced by this community. It means being aware of and addressing issues like internalized homophobia, fear of coming out, and experiences of discrimination and violence. Having staff who are trained in these areas and who can provide a safe, non-judgmental space is crucial. Another aspect is incorporating therapies that directly address the minority stress that we were just talking about. This could involve techniques that help individuals understand and manage the stress that comes from living in a sometimes unaccepting society. It's about giving them tools to navigate these unique stressors in healthy ways. Also, considering the high rates of co-occurring mental health disorders in this community, it's important to have an integrated treatment approach. This means not just treating the substance use issue, but also addressing any accompanying mental health challenges like anxiety, depression, or trauma. This integrated approach ensures that all aspects of a person's well-being are being cared for. Family therapy can also be a significant component, especially for younger individuals. It can help bridge understanding and support within the family system, which can be a huge factor in recovery. In cases where family support isn't available, building a strong peer support network is equally as vital. Peer support groups that are community-specific can also provide understanding, shared experiences, and a sense of belonging. In essence, while evidence-based treatments like motivational interviewing, CBT, and social support therapy are foundational, their effectiveness is amplified in this community when these specific adaptations are made. It's about addressing the whole person, their unique experiences, and creating a treatment environment that truly understands and supports their journey towards recovery.
What are the essential components of creating safe and inclusive spaces for individuals in the LGBTQIA plus community seeking recovery from substance use disorders? How can these spaces promote acceptance, understanding, and a sense of belonging?
All right, so building on what we've talked about regarding the unique needs of this community in addiction recovery, let's talk about what it actually takes to create safe and inclusive spaces for them. Imagine walking into a place where you feel immediately welcomed and understood. That's the goal for these spaces. First of all, the staff plays a huge role. They need to not just be trained in addiction treatment, but also in the nuances of the LGBTQIA plus experiences. It's about knowing the right things to say, the right questions to ask, and creating an environment where everyone feels respected. Visibility of support's key too. It's the little things like having rainbow flags, inclusive posters, or even just a simple form that asks for a pronoun. These small gestures can send a huge message of acceptance. Peer support groups are like the heart of these spaces. They offer a chance to connect with others who truly get it. Sharing stories, struggles, and victories with peers can create a powerful sense of belonging and community. We also can't ignore the mental health piece. A lot of people in the LGBTQIA plus community deal with things like anxiety, depression, and trauma, as we talked about earlier. So having mental health services right there as part of the recovery process is crucial. Family involvement can be tricky, but also important. For some, family is a source of strength, but for others, it might be more complicated. But where possible, bringing in families for education and therapy can help mend and strengthen these relationships. Addressing the minority stress directly is also essential. This involves having therapies and activities that lets people cope with the stress that comes from facing the discrimination and stigma. We also can't forget about making everyone feel physically comfortable. This means things like having gender-neutral bathrooms and just being mindful in general of people's accommodation needs. Integrating fun, social activities that are substance-free can also play a huge role. It's about showing that life in recovery can be enjoyable and fulfilling. Lastly, connecting individuals to the broader LGBTQIA community resources can help them build a supportive network that extends beyond the treatment setting. Basically, these spaces are all about just creating a nurturing environment that promotes acceptance, understanding, and a sense of belonging. It's where individuals can not just address their addiction, but also find support and validation for their entire being.
How can we challenge stereotypes and misconceptions surrounding substance use disorders in the LGBTQIA community? What role can education and awareness play in reducing stigma and promoting empathy?
Tackling stereotypes and misconceptions about substance use disorders in the LGBTQIA community, it's really about opening eyes and minds. It's a lot about education and awareness and how they can be powerful tools in reducing stigma and fostering empathy. Let's break it down a bit. Education is key here. It's about getting the word out. The higher rates of substance use in the community are not because of who they are, but rather what they face. Discrimination, societal pressures, minority stress, these are big factors. When people start to understand this context, it shifts their perspective. It's no longer about a stereotype. It's about seeing the real challenges behind the issue. Now, awareness campaigns can take this to the next level. Imagine campaigns that tell real stories of LGBTQIA individuals dealing with substance use disorders. These stories can be eye-opening. They bring a human element to the stats and figures, helping people to connect and empathize. It's about showing that behind every statistic there's a real person with a story. Another big part is inclusive research and representation. This means involving the community's voices in research about substance use disorders. The more representative that the research is, the more accurate the picture that we get. And this isn't just about better treatment approaches, it's about actually changing the narrative. Healthcare professionals play a huge role too. When they receive training on LGBTQIA specific issues, it can change the game in treatment settings. It helps them provide care without bias and help them understand the unique challenges that are faced by this community. Community engagement is also crucial. When all these groups get support, it helps reduce isolation and build a sense of belonging. It's also a powerful way to change the conversation around substance use disorders. Then there's policy advocacy. Pushing for policies that actually consider the needs of this community can create more supportive environments. It's a way to tackle this issue from a systemic level. We also can't forget about the media. The way the media portrays these individuals and their struggles can really shape public perception. Responsible and accurate media representation can go a long way in breaking down stereotypes and building empathy. So, in summary, it's a combination of storytelling, research, professional training, community support, policy work, and media representation. All of these elements together can help reduce stigma and promote empathy towards the LGBTQIA community dealing with substance use disorders. It's about creating a more understanding and empathetic society where everyone feels seen and supported.
Can you name some of the resources and support networks available for individuals in the LGBTQIA community struggling with substance misuse? And how can we ensure these resources are accessible and culturally sensitive?
Certainly. Let's discuss the resources and support networks available for individuals in the community, and let's also dive into how they can be made more accessible. One of the standout resources is the Trevor Project, which is particularly beneficial for younger individuals in the community. They offer a huge range of support services, including counseling and support through phone, text, or chat. This accessibility is crucial because it provides immediate support, especially for those dealing with both addiction recovery and issues relating to sexual orientation or gender identity. There's also a ton of private treatment programs that do specialize in community-specific substance abuse treatment at all levels of care. One example that comes to mind is the Pride Institute, which is located in Minnesota. A great way to find these programs is by utilizing the SAMHSA National Helpline. So SAMHSA is the Substance Abuse and Mental Health Services Administration, and they play a huge role in helping the community find appropriate treatment for substance use disorder. The National Helpline, which by the way can be called at 800-662-HELP, is a confidential, free, 24/7, 365 service. The helpline provides individuals and families facing these kinds of issues with information and treatment referral services, and I believe it's available in English and Spanish. For the LGBTQIA plus community, this helpline is a crucial starting point to find treatment options that are sensitive to their specific needs. Moreover, SAMHSA has an online tool that can be used to find treatment facilities in the U.S. This tool is particularly useful because it allows people to filter search results based on various criteria, including LGBTQIA plus friendly services. This ensures that the treatment options are not only relevant, but also sensitive to the unique challenges faced by the LGBTQIA plus community. SAMHSA also has various resources and publications that can help guide individuals in finding inclusive providers. These resources offer information about the type of care that is most appropriate for the community, which covers cultural, clinical, health, administrative, and legal issues, as well as alliance building. By leveraging these resources, members of the community can find treatment options that aren't only effective, but also culturally competent and understanding of their unique experiences. For those looking to quit smoking or manage nicotine addiction, the Smoke Free program offers LGBTQIA plus friendly helplines and treatment options, featuring a text chat service and support app. This program acknowledges the specific challenges faced by the community in smoking cessation. Beyond these specific programs, individuals seeking local resources can do a web search using the keywords LGBT Center and then your city. It'll help them find local organizations that will point them towards services. I know here in Los Angeles, where I'm based, there's several LGBT centers that offer tons of local resources, including providers, mental health care, medical health care, and pretty much anything that somebody in the LGBTQIA plus community may need. Regarding accessibility, ensuring that these resources are accessible and culturally sensitive involves several key actions. First up, as we discussed earlier, we've got training and education. It's all about making sure that the people who are there to help, like healthcare professionals and support staff, really know their stuff when it comes to the unique needs and challenges of the community. Think of it like giving them the tools they need, not just to understand, but also effectively support anybody who walks through their door. Next, we've got community engagement. This is huge because it's all about getting down to the grassroots and really understanding what people need. It means reaching out, having real conversations, and building partnerships with LGBTQIA plus organizations. It's like having your ear to the ground to make sure that nobody's needs slip through the cracks. Then there's the big one, inclusive policies. We're talking about fighting the good fight to make sure there's solid, supportive policies in place. This includes everything from making sure that treatment programs for the community are covered by insurance, to standing strong against discrimination in healthcare settings, which is an unfortunate reality even today. Visibility and awareness are next on our list. It's all about shining a big, bright spotlight on these resources. We're talking about social media, community events, and really any platform we can find to let people know that these resources are out there waiting to help. Last but not least, we've got cultural competency. This one's all about making sure that the services offered are actually hitting the mark for everyone in the community. It's really about recognizing that everyone's experience is unique, making sure that the services are sensitive and responsive to that diversity. So there you have it. It's about equipping the helpers with the right knowledge, listening to the community, pushing for supportive policies, shouting about these resources from the rooftops, and ensuring services are as inclusive and understanding as they can be. With these actions, we can create a support system that truly gets what it means to be part of the LGBTQIA plus community and is there every step of the way in the journey to recovery.
Can you share any success stories or examples of resilience from within your work of individuals in the LGBTQIA plus community overcoming addiction? And what factors contributed to their recovery journey?
In my years as a substance use counselor, I've seen several examples of transformation and resilience. But one particular client of mine, who I'll call Michael in this story for anonymity, would stand out as a profound example of somebody overcoming addiction within the community. So Michael grew up in a conservative, traditional household in a rural county where really any discussion about sexuality or gender identity were discouraged. As he grew up, he started to feel an increasing sense of being different, but he couldn't really express it due to fear of rejection from his family and the community around them. This caused him to suppress his feelings about being potentially gay or transgender. In search of peace, he found temporary escape with drugs and alcohol, starting in his early teenage years. The substances gave him a fleeting sense of it, allowing his true feelings to surface, but briefly. Once sober, he he would push these feelings down, continuing this relentless cycle of substance misuse and then emotional turmoil. This pattern made him a chronic relapser despite multiple attempts and several years spent in therapy and working towards recovery. But if the only time he could feel like his true self and be comfortable with these feelings of potentially being gay was right after a relapse on substances, it's almost hard to fault him for it. The turning point in Michael's recovery journey came when he started to embrace his sexuality. Through his own process of self-acceptance, he started to find genuine peace and self-compassion. It was a very gradual but transformative journey that I know was filled with fears and uncertainties. A critical factor in his successful recovery was the supportive environment of the treatment program he was attending here in Los Angeles. The approach with him involved clinicians who were not just knowledgeable in addiction treatment, but also deeply empathetic and supportive of LGBTQIA+ issues. This culturally sensitive environment played a vital role in helping Michael open up about his identity struggles. Another significant aspect was the inclusive and empathetic 12-step community here in Los Angeles. This community gave Michael a sense of belonging and understanding, which was crucial for his recovery and was something that he had never had before. The 12-step meetings offered more than just addiction or alcoholism discussions. They were a space for connection and shared experiences. And further, just the broader recovery community here in LA, known for its inclusivity, helped reduce the sense of isolation that often accompanied his struggles with identity and addiction. This vibrant and supportive environment was pivotal in his journey. So his own resilience and willingness to embrace his identity were key. The process of coming to terms with his sexuality and exploring his gender identity were essential steps in overcoming his substance misuse. He was able to figure out who he was in a place that supported him and understood him. And I'm happy to say that now he's a man living in recovery and is happy and on his way to lifelong recovery. So, in summary, Michael's story is just one testament to the power of a supportive, inclusive environment in the recovery journey of individuals in the community. The combination of LGBTQIA+ focused clinical support, a supportive 12-step community, the broader accepting environment of Los Angeles, and his own journey towards self-acceptance were instrumental in his transformation into a happy, confident individual in recovery. So I would say this story highlights the importance of tailored support that understands and embraces the unique challenges faced by this community in addiction recovery.
How can individuals in the LGBTQIA+ community build resilience and develop coping strategies to navigate the unique challenges they may face in recovery? And are there specific tools or approaches that have proven effective?
Building resilience and developing coping strategies are key for individuals in the community, especially when facing the unique challenges that come in seeking recovery. So let's talk about some effective tools and approaches that have been proven out. First, therapy plays a crucial role. It's a safe and supportive space to explore and understand identity, to work through issues like internalized homophobia or discrimination. Finding an affirming therapist who understands the specific needs of this community can make a significant difference in strengthening emotional well-being and enhancing relationship satisfaction. Another important aspect is educating oneself and advocating for LGBTQIA+ rights and resources. Being well-informed empowers individuals to challenge misinformation and stereotypes. Engaging in conversations, sharing personal stories, and experiences can be powerful in creating awareness and promoting acceptance within and outside the community. Self-care is also vital. Practices like meditation, exercise, journaling, or engaging in just any enjoyable hobby can help maintain mental health. It's really important to take breaks from social media or news that might be overwhelming to protect one's mental well-being. Finding and engaging in safe, affirming spaces, both online and offline, is crucial. Participating in community events, visiting LGBTQIA+ centers, or attending pride parades can provide a sense of belonging and support. Surrounding yourself with people who understand and validate personal experiences helps in building resilience and strength. Staying informed and engaged with legislative developments and policies that affect the community is also essential. Supporting organizations that advocate for equality and justice have a collective impact on systemic change. Being involved in advocacy work, whether through donations, volunteer work, or peaceful protests, contributes to a broader effort for equality and justice. Using your voice to lobby for change and understanding is critical. Knowing the legal protections available and connecting with organizations that offer legal assistance empowers people to challenge discrimination and advocate for inclusive legislation. Sharing personal stories has the power to humanize experiences and challenge stereotypes. Writing articles, creating content on social media, or even just participating in storytelling platforms sheds light on the challenges faced by the community and promotes a more inclusive society as a whole. Finally, to be an effective ally, it involves listening, learning, respecting, and validating the experiences of individuals in this community. Amplify their voices, challenge discriminatory practices, advocate for inclusive policies. Those are all important actions that allies can take. Allies play a pivotal role in creating inclusive spaces and advocating for the rights and well-being of individuals. In summary, coping with the unique challenges faced by this community in recovery involves a multifaceted approach. Therapy, education, self-care, community engagement, advocacy, and allyship. By utilizing all of these strategies, individuals can find strength, resilience, and support within their relationships and the broader community. But just remember, nobody's alone in this journey. A supportive and understanding community is ready to help.
Finally, regarding the LGBTQIA+ community, which specific areas of concern require more attention in terms of accessible and available treatment? For example, should we prioritize training more providers to offer gender-affirming care? Also, what messages of encouragement and support do you have for our audience members who are struggling with substance use disorders within the LGBTQIA+ community?
In addressing the specific areas of concern for accessible and available treatment for the LGBTQIA+ community, the financial barrier is probably the largest one I see today. Many individuals in this community, and in the country as a whole, don't have adequate health insurance, which limits their access to quality substance abuse treatment and mental health care. Even for those with expensive, low-deductible health insurance plans, I've seen many providers cut their reimbursement rates for these services so low that a lot of providers who do accept insurance won't accept those plans. One such example here in California is Blue Cross Blue Shield of California. They're one of the biggest health plan providers in the state, yet they have so many restrictions and such low reimbursement for behavioral health services that many places can't accept it at all. A detox program alone can cost over $1,000 a day. Add that to the $30,000 that a month in residential treatment costs, and how can most people in this country pay for that? Then, the high cost of private practice counselors and therapists, often being at minimum $80 to $120 or more per session, poses a huge challenge, especially for those unemployed or working part-time. This issue is compounded by the fact that many providers are cash pay only, which restricts options for those who rely on insurance coverage. These financial challenges make it difficult for the LGBTQIA+ community to access the care they need, which often may not even be covered under their basic health plans. Addressing these financial barriers is essential for ensuring equitable access to mental health and substance abuse services for all members of the LGBTQIA+ community. Some solutions could include advocating for more comprehensive behavioral health benefits within insurance plans, increasing the number of providers who accept insurance, and expanding funding for community-based programs that offer low-cost or sliding-scale fees. Additionally, there's a need for more mental health care providers who are educated and informed about the unique challenges faced by the community. Many individuals encounter barriers like uneducated providers and discrimination within healthcare settings. So yes, ensuring that mental health care becomes more universally inclusive through education and pushing for this education among healthcare providers are vital steps. It's not just about having more providers or more providers that accept insurance, but also just ensuring that these providers are actually affirming and understand the specific needs of this community. And finally, to any listeners within the LGBTQIA+ community who are navigating the challenges of a substance use disorder, I just want you to know that you're not alone. Recovery isn't just a possibility, it is within your reach. Your identity, your experience, your story, it all matters, and it's all a source of strength. Remember that every step towards recovery, no matter how small it may seem, is a victory. You have a community that understands, supports, and believes in you. Embrace the help that's available, whether it's therapy, support groups, or community resources. You're valued, you're strong, and you are capable of overcoming these challenges. Your journey to recovery is a testament to your resilience and courage. You just got to keep moving forward, one step at a time, and know that a brighter, healthier future awaits you. Don't hesitate to reach out for help.
Thank you, Daniel, for your time, insights, and expertise. We have come to the end of our show today. I want to express my gratitude to Wish Recovery for their unwavering support of this program and for their dedication to helping individuals with substance use disorder or dual diagnosis heal and take control of their lives. If you haven't already, kindly subscribe to our channel to stay updated on new episodes and explore our previous episodes that examine the landscape of substance misuse and dual diagnosis from various perspectives. Thank you for tuning in to Recovery Dialogues and Sober Stories.